Hello, I'm Laura Pollock. I'm a nurse practitioner student at Maryville University, and this is my head-to-toe assessment. My patient today is my daughter, Allie, and before we came in, I had her empty her bladder. I got her height and weight. We did a full set of vital signs. I checked her distance vision with the Snellen chart and her near vision with the Rosenbaum chart, and I had her put on a gown. Now we'll get started. First, we're going to assess the head. We're going to look at the placement of the head on the body. We want to palpate the skull to assess for any masses or nodules. We want to assess the hair. We want to look at the texture of the hair, the thickness of the hair. We want to see that the hair does not release into our hands when we run our fingers through it. We also want to look for any areas of alopecia. Now we'll move on to the face. We're going to look at the face and the symmetry of the face, the eyes symmetry, the nose symmetry on the face, and the mouth. We want to palpate the facial bones for any tenderness. We're going to assess her temporomandibular joint. We're going to have the patient open and close her mouth. We're assessing for any popping or clicking. Good. Now we'll assess the frontal and the maxillary sinuses for any tenderness. We also want to look at the skin to make sure there's no areas of redness or irritation and that the pigmentation is even. Now we'll assess the eyes. We're going to look at the eyebrows to make sure they are full and they extend outward from the eyes. We're going to look at the lashes to make sure they are also full and that they are extending outward. We'll want to assess the eyelids for any unusual lesions and assess the skin. We want to palpate the lacrimal apparatus. Now we're going to assess the pupillary response to the thin light. We're going to assess direct and consensual response. That is normal. We want to assess the sclera and the conjunctiva. The sclera should be clear and the conjunctiva should be pink. Now we're going to perform a cover test to check for extraocular movements. We're going to have the patient look at a point on the wall for me, look straight ahead, and cover one eye, and uncover, and cover the other eye, uncover. Good. Now we're going to assess the cardinal fields of gaze. I will cover my eye, and the patient will cover the opposite eye. Tell me when you can see my finger. Now, 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 now. We'll do the opposite side. Now, 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 now. Very good. And at this point, we can go ahead and check cranial nerves. We'll have the patient scratch up her forehead. Good. Close your eyes really tight. Smile. Stick your tongue out. Move it side to side. And puff your cheeks. Very good. Now we can assess the ears. We want to palpate the auricle to make sure there's no tenderness or any nodules. We can go ahead and assess for hearing. We'll begin with the Weber test. I'm going to place the tuning fork in the center of her head, and she will let me know when she no longer hears it. Now we'll do the run test. We'll place the tuning fork on her mastoid bone to check bone connectivity, and then once she cannot hear that, we will move it to the outside of her ear to test for air connectivity, and the patient will let me know when she can no longer hear it in both areas. Yeah. Yeah. Do that on both sides. No. No. Good. We'll go ahead and assess the internal of the ear. We'll use the otoscope, lifting the pennant upward. We're looking in the auditory canal. We're going to make sure we don't see any signs of erythema. We're going to look for cerumen and no edema. The TM is clear with a pearly appearance. We'll do both sides. Mild serum noted. The TM is clear and pearly. There was no erythema or edema noted. Now we're going to do a touch test on the patient's face. She's going to let me know if she feels it equally on both sides. Yes. 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 Good. I'm going to move around behind the patient in a sense hearing. With a whisper test, I'm going to say a word and have her repeat it to me. Cat. Dog. Good. Now we can move on to the nose. We want to assess the nose. We're going to look at the position of the nose on the face to make sure it's symmetrical. We want to look at the mucosa and the turbinates. The mucosa should be pink. The turbinate should not be swollen or blocking the nasal passages. We will look at the septum to make sure that it is not deviated. Now we'll assess for patency. I'll have the patient cover one nostril and breathe in. And let's do the other side. Good. No problem there. Now we're going to look at the patient's mouth. We want to look at her lips to make sure they're pink and full. We want to assess if there are any ulcers or blisters or any fissures around the mouth or in the corners of the mouth. Then we'll have the patient open her mouth. We're going to assess the teeth for quantity, color, and for any dental caries. We'll look at the appearance of the teeth to see if they're in good shape. We also are going to assess the buccal mucosa, the tongue, the under the tongue, the floor of the mouth. We're going to check the hard and soft palate. And her buccal mucosa is pink. Her tongue is pink and moist. You lift your tongue for me. And turn it to one side. There we go. We look at the lateral side of the tongue. We're looking for any ulcers or blisters or any lesions. Okay. Open one. Say ah for me. Ah. Good. Look at the anterior posterior pillars that are normal. We're looking at the uvula to make sure it is moving correctly and is midline. We're looking at the tonsils to make sure there are not edematous and there are no exudates. We're also looking at the oropharynx to make sure there is no erythema or drainage noted. At this point, we're going to check the patient's gag reflex. Good. Now we're going to move on to the neck. We're going to assess the position of the neck on the body. We're going to look for any edema or any swelling or any unusual changes in the skin. We're also going to palpate. Looking for any masses. Her trachea is midline. We're going to palpate the thyroid. I'm going to move it to the side and have the patient swallow for me. That's smooth. We're going to check her carotid pulses one at a time. And we're looking for any signs of JVD, and none are noted. And at this time, we'll go ahead and auscultate the carotids for any bruits. Have the patient hold her breath. And we'll go ahead and auscultate the thyroid also. Now we can go ahead and assess the lymph nodes. We'll start with the preauricular, postauricular, occipital, tonsillar, submandibular, submantle. Look at the supraclavicular. Look at the cervical chain. Look at the posterior chain. And at this point, we can go ahead and check for axillary. And we'll go ahead and check the patient's axillary nodes, noting that none are palpated on the exam. And now I'm going to have the patient turn around and we'll assess for that. We're going to look at the skin colorations. We want to feel if there are any unusual nodules. We also are looking for any lesions that may be unusual. We'll go ahead and auscultate breath sounds. We're also assessing chest rise and fall and her respiratory rate as we do this, which should be usually around 18. We're going to look at the symmetry of her back as she's breathing in. And we can place our hands on the 10th rib. We'll have the patient take a deep breath. And we're looking for symmetry of her chest rise and fall. Good. Now we're at this point, we can go ahead and palpate her CVA. With light palpation. And then we'll have direct percussion. Okay. Yep. 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 We can go ahead and check for tactile primitive. I'm going to place my hands on her, my palms first. And we'll have the patient repeat 99, 99, 99, 99, 99. 99, 99, 99, 99. And we're assessing for tactile primitives for that. We'll go ahead and measure for her diaphragmatic excursion. We'll take our pen. We'll have the patient cross her arms and lean forward for me. And we're going to indirect percuss up from the hip. Change in sound. We'll mark that point. Have the patient take 2 or 3 big deep breaths, breathe in and out. And then on the last one, hold for me. And that should measure in between 3 to 5 centimeters. As we were assessing the patient's symmetry of breathing, the anterior-posterior diameter of the chest should be 1 to 2. We're also looking at the cervical spine, if you can see, and palpate that while we have the patient in this position. Now I'm going to have Allie turn around for me. Now we can assess the chest. We're looking for chest rise and fall. We're looking at symmetry of breathing. We're going to can also assess for respiratory rate from this point. We can go ahead and auscultate breath sounds. We can go ahead and also auscultate lateral breath sounds. And while we're here, we can go ahead and auscultate heart sounds. Starting at aorta. Pulmonary. First point. Tricuspid. And mitral. We're also assessing the precordium for any heaves, thrills, or pulsations. And we can assess the apical pulse. We'll also repeat our assessment for tactile primitives and having the patient say 99, 99, 99, 99, 99? 99. Good. Okay, we're going to move on to the abdomen at this point. We're going to have the patient lie flat. We're going to look at the abdomen. We're going to look at the shape of the abdomen. We're going to make sure we don't see any unusual pulsations. We're going to look at the skin on the abdomen and assess for any lesions or any unusual color. We're going to make sure that the skin is warm and it's not moist. And as we look at her stomach, we're going to look for the abdominal muscles and also assess them. At this point, we're going to go ahead and also take for vowel sounds in all 4 quadrants. And we can stay up to 5 minutes per quadrant to hear the use of the vowel sounds. At this point, we can go ahead and assess for auscultation of the mouth, cranial arteries, iliac, and general. Now we'll start with indirect percussion. We should hear dull sounds over organs and tympanic sounds over air-filled areas. Now we can palpate. We'll start with light palpation. We're feeling for any nodules or masses, any areas of pain or discomfort for the patient. And now we'll start with deep palpation. We want to palpate the liver borders. Good. We want to palpate the kidney. We want to palpate the aorta. We want to palpate the splenic border. And the opposite kidney. So we're looking for any unusualness, any enlarged organs, or any nodules or masses felt on those palpations. And we're going to go ahead and assess the extremities. We're going to look at the upper and lower extremities, assessing the skin. We're going to look at the color and the temperature and the pigmentation. We're going to assess capillary refill to ensure that it's less than 3 seconds. And we want to make sure the patient has full range of motion. We're going to assess the brachial and radial pulses on both sides. And the same with the legs. We're going to look at the skin. We're going to look at the pigmentation. We're looking for any unusual colorations or lesions. We want to assess for temperature. We will look at hair distribution on the upper and lower extremities also. And we will assess for popliteal pulses on both sides. Posterior tibial. And dorsalis pedis. And we want to ensure that those are equal in rhythm and rate and quality bilaterally on each side. We want to note for any edema or erythematous areas on the upper and lower extremities also. Now I'm going to have the patient sit up for me. We're going to test her extremity strength. We have her pull, push, good. Same here, pull, and push. Just testing her strength and muscle quality. We want to make sure that the muscle mass is equal on both upper and lower extremities equally to the opposite side. Now we're going to test her response to dull and sharp sensation. I'm going to have the patient close her eyes and she'll tell me if I'm touching her with an object that is dull or is sharp. Dull, sharp, dark, dull, sharp, dull, sharp. Good. Now I'm going to have the patient stand for us. And we're going to assess her ability. At times we would assess gait at this point. We're going to have the patient bend for me. Assess her range of motion. We can also assess the spine at this time. Any pain in the knee? At this time, we're going to assess the patient's reflexes. And we'll start with brachial. Good. We're going to test the knee reflex. And we're going to test the Achilles tendon reflex. Good. And this concludes our head to toe assessment.